Alberta, Canada. Home to a publicly funded healthcare system focused on patient-centered care. Serving Albertans with world-class healthcare facilities. Contributing to the advancement of healthcare through research, regionally and internationally.
We are largely considered one of the best idea-generating institutes out there.
There's really no program that's as powerful, as strong in all of Canada.
On a daily basis, we're creating the best healthcare system that we've ever seen.
Children's hospitals are quite different these days than they were even 10 years ago.
They brought in things like color, things like light, sound, programs that are complementary to medical practices.
We have art therapists, music therapists, and a horticultural therapist. We learn a lot about how the kids are coping and what help they need.
Everything has been thought of, from the environmental impact to the patient's needs. People come for heart bypasses, valves repaired, transplants. There's been so many innovations, from reducing lengths of stays to improving outcomes for patients.
We have one of the only centers that combines comprehensive tissue center. So we have a tissue bank that collaborates with our organ procurement program and with our transplant services program.
Once you come into this institute, you are now surrounded by all the professionals, and we treat you as a team. The main work areas are in head and neck reconstruction, prosthetic rehabilitation, and bone conduction amplification. We have an ISO certification for our care. We pride ourselves on being a translational environment where we can take those innovative technologies, move them forward into the clinical world so that the patients that we treat have better access to better care.
These chambers here are the only hospital-based chambers in all of Alberta. We're decreasing the amount of suffering that patients are having, and we're helping them advance their lifestyles and advance their quality of life. Keeping up with leading-edge treatment and therapeutic plans, it's just only going to lead us into the future with so many different things.
The technology here in nuclear medicine is quite fascinating. We take radioactive isotopes, we attach them to radiopharmaceuticals in order to follow and discover disease processes in the body.
You're working with people that on a daily basis believe in moving forward and ensuring that Albertans have the best healthcare that's possible. We're able to balance out improving access, improving quality, and ensuring that the system that we're creating is going to be sustainable.
We take these babies to different outreach programs and do pediatric trauma simulation with them so that they're able to learn in a real life situation, but it's not a real life person. So everything is real time, the meds are drawn up, the x-rays are done. I think that's a huge benefit to working at the Children's Hospital as far as learning.
Our reputation throughout Canada is one very, very highly honoured. We have state-of-the-art equipment. We have physicians that are readily accessible to our patients. Brought in the new dialysis machines. We trialed them actually the first time in Canada. Since we've been using them, we have a more clear understanding of what's going on in the process of the dialysis, and we can cater to the patient's changes much more rapidly.
We are labor, delivery, recovery, postpartum, all in one. Basically, we get to see the moms from start to finish, so we get a full spectrum of care. That experience of helping new life come into the world is just amazing.
This is the only place I've ever worked where we have researchers who are right here on the unit with the staff, and they build off each other. Nurses feel like they're being asked to influence new design and innovation in healthcare, and then the researchers actually get to come to the front line. You see patients in private rooms with no curtains. You see more hand washing sinks. You see equipment that's patient dedicated. Technologies that reduce the incidence of pressure sores.
We're very proud of our team, which includes specialists in orthopedic and plastic surgery, as well as emergency medicine physicians. And the excellent service that we provide the tourists from all over the world, including our local community.
We have surgeons that are world-renowned that work here. We attract a variety of staff. We've got it figured out. You know, if you need orthopedic surgery, come here.
We're probably, in North America, one of the only intensive care units with 2 neurointensivists. Most don't have any. We are able to treat these patients differently than they are in some facilities. Here we have a catheter that we actually place in the patient that we can very minutely manage their temperature. What we do here, not only do we save their life, we make their life better.
The team approach and interdisciplinary approach is so important because a lot of clients can be fairly complex. A successful day would be when I was able to help a client reach a goal.
We embrace the philosophy of patient family-centered care. It changes the model of healthcare. We partner with patients and families so that we become one team. It really gives you a sense of accomplishment, knowing that patients' needs were met.
Alberta is at the forefront of cancer care in the world. I get to provide a service to a patient that would normally have to travel 5 hours south, and I know they all appreciate the more one-on-one focus that we provide here. When my patients are happy, I'm happy. I really care what they, their opinions and what they think is important.
Bottom line is that it's all about the patients.
Everybody can get the care they need when they need it. I'm going to be able to provide the best care for my patients here because I have the facility and the resources to be able to do that.
If you can come back on the day where we hook up a hearing aid for the first time for somebody who hasn't heard well their entire life, I would never ever grow tired of that feeling.